Hypertension Awareness Series Episode 2. How blood pressure works, understanding the numbers. Good morning. Today we are going to learn about the numbers of blood pressure. Blood pressure is measured using two numbers, the systolic pressure and the diastolic pressure. And understanding these numbers is essential to understanding your heart health. So what do these numbers mean? Systolic pressure, the top number, measures the force on the artery walls when the heart contracts and pumps blood. Think of it as the push. So systolic pressure, the top number. Diastolic blood pressure is the bottom number. It measures the pressure in the arteries when the heart relaxes in between the beats. Think of it as the rest when the heart relaxes. So the normal blood pressure is pressure less than 120/80. 120 is the systolic and 80 is the diastolic pressure. So high blood pressure, as we learned in episode 1, is pressure more than 140/90, ESC and Kenyan guidelines, or more than 130/80, the American guidelines. Diagnosis requires persistent reading, not just a single measurement. We also have isolated systolic hypertension. Doc, I'm okay. It's only the high pressure that is high. This means when your systolic pressure is more than 140, but the diastolic is less than 90. For example, pressure of 165/75. It is associated with vascular stiffness, arterial stiffness, and vascular aging. And it is associated with high cardiovascular risk, especially in adults. Isolated systolic hypertension is never benign. It needs aggressive risk factor management and control of pressure. On the other side, we have isolated diastolic blood pressure, where the systolic pressure is normal, less than 140, but diastolic is over 90. For example, BP of 125/108 is isolated diastolic hypertension. This occurs in the younger. It's associated with stress, obesity, physical inactivity. And even elevated diastolic pressure is not innocent. It increases the risk of future hypertension and cardiovascular damage. So the important message is, even if only one is elevated, systolic or diastolic, damage still occurs. Do not ignore elevated blood pressure. When the pressure is persistently elevated, the arteries become stiff and leads to damage to the organ. So today we have learned that the systolic blood pressure is the top number, diastolic pressure is the lower number, normal blood pressure is less than 120/80, whereas hypertension is pressure above 140/90 on repeated episodes. Isolated systolic hypertension, systolic pressure over 140, but diastolic less than 90. Isolated diastolic hypertension, systolic blood pressure normal less than 140, but diastolic pressure over 190. So what can you do today? Check your blood pressure if you have not checked it recently. Know your numbers. Please post your figures in the comments. Know your numbers. Awareness starts with knowing your numbers. Please share this post to help someone. Stay tuned for our next episode, where we learn why blood pressure matters. What is the organ damage you do not feel? Dr. Muthui-Mutua, saving lives one heart at a time.